Community Care Innovation and Technology Capabilities and Readiness Report, or as we will call it for the rest of this presentation, the Care IT Report. People are joining us from around the country, so we're just giving people a few more minutes to log in. As we prepare ourselves for this webinar, I'd like to introduce myself. My name is Dr. George Margellis, and I'm the Independent Chair of the Aged Care Industry Information Technology Council, and I will be the Master of Ceremonies for this event. For brevity, from now on, I will call our organisation the Council. Just giving people time to pop in, and now we have over 300 people registered to attend today's event, so hopefully people are starting to log in now. Okay, the numbers are going up. First, let me start by a welcome to country. I would like to begin by acknowledging the traditional custodians of the land on which we each gather at today and pay respects to their elders past and present and future. I extend this respect to any Aboriginal and Torres Strait Islander people who have joined us for the event today. I would also like to acknowledge and publicly thank all the health and aged care workers who are out there delivering care to the community. During this especially difficult time, I think it is important to recognise their efforts and let them know that they have our full support. I'd like to move on to some housekeeping for today. So before I move on, let's just cover a few housekeeping items. All microphones have been muted by the event manager to allow us to record the event. If you wish to ask a question at any time, please submit your question on the Q&A panel, which should be at the bottom or on the side of your Zoom screen, and we will answer these questions after the presentations. For any inquiries or technical support issues, please also use the Q&A panel, and the ACIITC Secretariat will answer your questions and help you with any technical issues you may have. The session is being recorded and will be available in a few days on our website. So just a reminder again, for any questions to the speakers or any technical issues or comments, please use the Q&A panel. So just a quick overview of what to expect today. Today, the Federal Minister for Aged Care and Senior Australians, Senator the Honourable Richard Colbeck, will be launching the Aged and Community Care Innovation and Technology Capabilities and Readiness Report. Following the official launch, members of the Aged Care Industry IT Council will speak to the findings of the report and what opportunities this provides for the aged and community care sector. We will have questions after the Minister's speech. We have a few minutes for questions, so if anyone has any questions for the Minister, please use the Q&A panel. And at the completion of the Minister's question time, we will move on to presentations by the rest of the speakers. For those of you who are not familiar with the Aged Care Industry IT Council, allow me to introduce ourselves. We are the Innovation and Technology in Aged Care and Community Care peak body, representing both the providers and the consumers of care in the sector. The Council has been active since 2007, when it was formed by the two peak bodies, ACSA and ACIITC, who later became LASA. At the time, a number of us identified the need for the aged care sector to embrace technology as a key enabler to prepare for the massive demographic, social, and economic changes ahead as the baby boomer generation, which I'm a proud member, reached maturity. The group was formed to assist the provider community to provide high quality care whilst ensuring their sustainability. This involved bringing providers, consumers, suppliers, payers, and regulators together to design a system which supported innovation and high quality care. So today is an exciting day for us at the Council. It is a culmination of almost 5 years of work since we started on the technology roadmap for aged care back in 2015. However, as noted before, our engagement with aged care and digital technology goes back even further. From the early parts of this century, with the IT for Aged Care roadshows, which were organised back then by Rod Young and Greg Mundy, through to the early ITAC events, which have been running continuously now for over a decade. Till now, the Council has been active supporting the aged and community care sector in this journey of utilising technology in delivering care. It has been a long, often rocky road, with many twists and turns. The rapid evolution of technology over this time, the changes to legislation and governance requirements, the advances in models of care and the way it is delivered, and the major demographic changes in the Australian population have all combined to make the journey challenging and, I must admit, very exciting. The one constant has been a desire by the vast bulk of the industry to provide safe, high-quality care to older Australians who need it. Some have stumbled along the way, and it is fair to say some have failed to deliver on this goal. Nevertheless, in my almost 20 years in this industry, I have constantly been delighted by the passion and desire of those involved to deliver, despite workforce, resource, and many other challenges in achieving that goal. Which brings us to today and the launch of the CARE-IT report. For the last 2 decades, we have called on the industry to adopt digital technology to help them improve their delivery of care. We have seen new local solutions developed and international solutions introduced into Australia. We have honoured many of these solutions and implementations at our ITAC awards over the years. And I have personally seen companies start from one-person operations to now have international presence. Information, which before was locked away in filing cabinets or archive boxes, is now available to care workers literally at the bedside. Administrators now have access to near real-time information about their organisation, from residential aged care facilities managing people with major disabilities to home care providers helping people stay in their own homes safely. We have seen many solutions introduced, develop, and evolve over this time. Despite the challenges, many organisations have implemented solutions to improve their quality, safety, and efficiency. We have been working so hard on doing stuff that we have not had the chance to step back and look at what we have been doing until now. Thanks to a grant and the support of the Department of Health, we have been able to take a snapshot in time of how the industry uses digital technology to help provide care. The CARE-IT report is that snapshot, a detailed survey of the aged care provider and vendor community's use of digital technology. As any good photographer will tell you, a good photo involves good timing and good lighting. Our detailed survey tools, workshops with providers and vendors and consumers, expert reference groups, and detailed research provided the lighting for this snapshot image. The timing was a bit more of a challenge, as literally the week we started on this project in mid-March, we faced the unprecedented challenge of the coronavirus pandemic. To some degree, this provided us an opportunity to evaluate the industry at a period of maximum stress, which in some ways makes for a better image, but also gives us a series of new insights. I do need to recognise the extra challenge it provided for the project team as we pivoted to a totally virtual environment, much like every other industry had to do overnight. It gave us a unique insight into the challenges faced by the industry in going digital whilst maintaining the delivery of care. But in this case, it was in a very accelerated way. There are many insights in this report, and we will be touching on them in the second part of this forum. They will provide useful information as we set out on the next steps of our journey. We have also made a few recommendations, which we will also discuss. We believe that better use of digital technology will help our industry evolve to a continuously learning, continuously improving, collaborative ecosystem focused on improving the quality of life of older Australians in a safe, efficient way. I know this sounds like a lofty goal. However, we are building it on very solid foundations. The vast bulk of the aged care provider industry has always had the compassionate care of our elderly as their primary goal. Our job is to make it easier for them to do so by the judicious, evidence-based, and properly supported use of digital technology. Together, we have an opportunity to support older Australians whilst also developing new opportunities for younger Australians in a vibrant, growing industry. What we learn and develop here is relevant around the world. We have an opportunity to demonstrate Australia's capability to identify and solve problems together. With this background on what I believe is a landmark report, which will set the groundwork for the development of digitally enabled aged care in Australia in the future, I would like to invite Senator the Honourable Richard Colbeck, Minister for Aged Care and Senior Australians, to officially launch the Aged and Community Care Innovation and Technology Capabilities and Readiness Report and give us his views on the role of digital technology and innovation in aged and community care. At the end of the Minister's presentation, we will have time for a few short questions. Thank you, Minister.
Thank you to George and the team for conducting this research and for holding this virtual event and inviting me to speak. I'm delighted to help launch the Care IT Research Report. The Australian Government funded this research to benchmark the aged care sector's adoption of digital technology. We believe it's essential to ensure quality aged care. Information technology plays an important role in the sustainability of the aged care sector and the delivery of government services. This year, with the pandemic, we've seen how technology can assist us in surprising ways. From the rapid expansion in use for telehealth to virtual events like this, working remotely or using QR codes for check-in at public places. It's been a year of adapting. It's also been a tumultuous year for many and certainly for the aged care sector. So I'd like to especially thank all of those who took the time to contribute to this research. Last week I met with representatives from across the health, professional and IT sectors to explore how current and reliable information sharing between government and the aged care sector could be implemented to support reform. It is clear there is a strong appetite to introduce new capabilities that better support the flow of information. The more information we collect and share as a sector, the better we are able to target policy priorities in a sustainable way and ensure the delivery of care that supports consumer choice and flexibility. Critically, it will provide better quality care and clinical outcomes for residents. The results show that there are significant opportunities to improve and expand the use of technology and innovation in 5 key areas, including business administration, online access to government, and surveillance and monitoring technologies. The research highlights that the sector has responded and adapted to the challenges presented by COVID-19 and accelerated the adoption of technology. However, there's still a digital divide in the aged care sector in areas which indicate there is work we need to do to ensure we keep pace. This includes gaps in cyber resilience and security, client management systems, and overall adoption of technology. The report makes 9 recommendations to change that and lift the sector as a whole. The Department of Health will work closely with the Council to determine the best way to progress these recommendations as they develop a reform package for My Aged Care and the underlying capabilities required for the future. Once again, I would like to thank the Council for undertaking this important study. I look forward to working with you and with the sector to act on its findings, and it will be an important part of our drive for better and more uniform quality care for senior Australians. Thank you.
Thank you, Minister, for your time today to launch this important publication for the industry. The Minister has agreed to take some questions, so please use the Q&A panel to ask any questions of the Minister. We already have a few questions coming through, so I'll take my opportunity to start asking questions. So, Minister, the recent findings of the Council for the Royal Commission highlighted the need for more research in aged care around the use of innovative models of care. They recommended things like the Research Council. One of the key issues, of course, is that we don't have a strong academic group in aged care research at the moment. Is the department looking at supporting the use of the growth of aged care research in the country?
Well, clearly, one of the things that comes out of this report, but also the Royal Commission talks about the need to improve our research capacity. That's one of the things that I think the Royal Commission will recommend. And so there's clearly a path that we're going to have to consider in that sense. And I think one of the other things that will actually drive all of these things is some of the conversations that I've already been having around the government pushing the need for uptake. As I said in my presentation, there's been significant uptake and adaptation over the last 12 months or over 2020, just because of the need pressed upon us by the COVID-19 circumstance. So you'll see, you will see from government a strong push towards the use of technology, the utilisation of the data that comes from that, both in our assessment of the sector, but also in the way that we look at and report to the public around the provision of quality care. So it'll be both of those things.
Thank you, Minister. Following on that, because many aged care providers at the present aren't really set up to get actively involved in research. I mean, they've got the clientele who need the care, but the academic rigour around research. I know the digital health CRC, for example, has been supported by the Department of Health to also look at aged care, and NHMRC does work specifically focusing on aged care. But one of the challenges we face is that aged care is more than just longevity, it's around quality of life care. Any comments on what sort of outcome measures you'd be looking at that demonstrate improvements in quality of life, and how we can use technology to best measure those in real time?
Look, George, I think this is going to be one of the critical things that assists us with this information and data, and the Royal Commission's draft recommendations from Council Assisting talked about the paucity of information and data that's available. And I think that the uptake of technology, the utilisation of technology in recording and measuring the outcomes as we decide as a sector what our quality indicators will be, the reporting of those, the access to the information and data on those broad range of quality indicators is going to be absolutely vital in assisting with research. The Royal Commission talks about collecting once, using the data many times, and the uptake of IT, I think, is going to be absolutely vital in assisting that, as well as being a critical factor in how we appropriately provide oversight to the sector, and how the Quality and Safety Commission, for example, can use the data that it's receiving to analyse how the sector's going, look at outliers, and then appropriately apply its regulatory framework to those areas where the data is actually demonstrating a need to, which will make all of those things more efficient, but give us much, much better information around a range of indicators that we need to understand and then report back to the public on the quality of provision of aged care in the country. So I think that the use of technology and the data that comes from that is going to be an absolutely vital enabler of both research and also the reporting to the public, and the level of public confidence that that exists into the aged care sector.
Thank you, Minister. Question here from Jay Singh around community care. So home care packages have been a large part, and you announced recently an increase in the availability of home care packages. And what we've seen as a result of COVID have been some very innovative uses of technology in the home care sector. I note that the Australian Digital Health Agency recently gave an award to a local provider who provides a home monitoring solution for chronic disease and aged care. Are we looking at providing new home care packages that are focused on the technology side, or is the technology meant to be just part of the core provision of care that aged care providers deliver today?
Look, I think that the technology will fit into the way that providers actually provide care. It will be an integral part of the process. Obviously, we're looking right now at how we reform the provision of care at home. We have everything from CHSP and quite simple services through that process, through the levels of home care packages. We will be looking to provide a continuum of care in the way that we reform the way care is delivered in Australia, from those simple services right through into residential care. So the continuum will be right through the provision of care services. There will obviously be more capacity pumped into the system with respect to care at home, but I see that in the terms of providing oversight of that care, but also using IT and digital systems to assist with the delivery of care is going to be a part of the overall way that that IT is integrated into the system. So again, it will play a vital part in that role. And of course, then again, the information that becomes available to us from that can also be a part in the way that we continue to develop how the system works.
Thank you, Minister. A question which has come up a number of times is around residential aged care minimum data sets. So we know that a lot of information goes from residential aged care to the government and back. And obviously that information has a lot of value, both in understanding the acuity of care required in the residential aged care facilities, but also the core billing requirements and financial requirements. I know there's work being done within the department now looking to co-design on those minimum data sets. Any comments on how we can develop minimum data sets which are useful for both the government as a payer, the government as a regulator, and the provider as a provider of care, how we can work together to make that, streamline that process?
Look, I think this is going to be one of the vital pieces of reform that we do, because the information that's collected needs to be of value to us all. And the Royal Commission talked about that, and I mentioned it a moment ago, collect once, use data many times. And so what we will need to do as a government is to build and provide a strong government to business interface so that we can receive the data. We need to specify what the data is that we actually need, whether that be financial information, which we need to collect and understand to ensure proper financial oversight of the system, or whether that be quality indicators and information with respect to residents so that we can ensure that we have appropriate quality oversight. But providers themselves should be asking very similar questions with respect to all of those matters. And so the utilisation of that information by providers in their provision of care should be a vital part of the way that they operate. They should be receiving regular reports to their management and boards so that they understand what the quality indicators that are also publicly reported are saying. It'll be a vital part of their information to the operation of their business, and clearly an important part of the way that we provide oversight, but also be an important part of our reporting to the public, so that the public, residents and their families can have a strong understanding of the reporting from those quality indicators. And as I said, it'll be, I think, a really important part of the way that we continue to build and improve the public perception of residential aged care in this country, because we have that open public reporting of those quality indicators and the information that people are seeking out. So I think, again, collect once, as the Royal Commission said, use many times, and all of us need to work together to identify what those quality indicators are. We currently have 3. We're going to move to 5 next year. The Royal Commission talks about having a suite of more than that, 9 to 12 perhaps. The paper that they prepared with respect to quality indicators I thought was quite informative. So there's a significant amount of work to do together to identify, build those things, and then to build the systems that provide that reporting. And in the context of quality indicators, I think that work being done, as you've indicated, as we see in some providers now, the quality information can be effectively automatically reported back to the department, back to the government, the Quality and Safety Commission, and also to providers, so that it can be used almost in real time. And I think that'll be a really valuable part of the added application of IT into the aged care sector.
Thank you, Minister. Another question here. One of the things highlighted by the Royal Commission was the often difficulty associated with transfer between aged care and acute care in many facilities. And obviously this issue was highlighted even more by the COVID crisis. We do have in the acute care sector, or in the health sector, the My Health Record project underway, which has been a bonus in enabling many clinicians like myself to have access to information about patients that we didn't have before as we treated them. Is there work being done within the department to synchronize the work between my aged care and my health record, maybe ultimately moving to a single record for both aged care and healthcare for individual Australians?
George, I have had some conversations with respect to utilising existing systems rather than trying to build new ones. I think that we ought to be trying to build on the good base that we already have. It does raise the spectre of a single health record, and for some people that's a challenge. But I think that building the systems to work together as much as possible is what we should be doing, so that there can be an integration and an easy flow of information across systems. We don't want to be building systems that are not compatible with each other. And so we have that really good base of My Health Record. The more that can be used in the interests of Australians for their health provision, I think the better. And so they have to be compatible.
Appreciate that. Yes, and I know there's already work underway within the Digital Health Agency to look at how aged care can benefit more from the use of the My Health Record. I think it's really important here for both the provider industry and the vendor community to work together to develop those solutions. A common question we're getting, and obviously you've read the reports recently about the financial challenges in providing aged care in Australia, is that to implement technology within many organisations requires investment. And often most organisations don't have a strong capital base in which to rely upon. Is there any thought from the government about how they can help organisations delivering care invest in technology in a way which ensures their sustainability, but also ensures that they make proper evidence-based decisions, and rather than just buying the cheapest thing they can afford to buy at any one time?
Look, there is, George, and we will consider that. I will say, though, that there are a lot of providers who have taken the time to do the work, and some of them not large providers, some of them small providers, 40 beds or under, and I've spoken to them, I've seen the work that they're doing, understand pretty well how they're applying technology to their benefit. And they acknowledge to me that there is a payoff period. So I would urge all providers to be looking at this very closely. We will have a very strong position on this, as I indicated to a group that you were involved with last week. I think that the government will be going to, this is not a choice type of exercise. So we will be expecting providers to be reporting to us the types of things I talked before, their financial data, their quality indicators, those sorts of things. Digitally, we need to build the government to business interface to be able to do that. We won't be providing a franchise to any particular IT provider, but we were saying, this is the information we want. This is the standards that will apply to the supply of that information, and this is how we will want to receive it. So I would say to everybody in the aged care sector, you should be looking at this. But yes, we will consider that, because we do understand for some it won't be an easy move. And we are having some of those conversations already.
Appreciate that. And one of the initiatives we're working on here at the council is to help to develop a digital maturity and a return on investment model, so that aged care providers can go into discussions with vendors around purchasing new innovation equipment. That's
a really important piece of research, George, and I noted that was mentioned in the report. So I think that will be really valuable for people, so they do understand that there is a value from a number of perspectives in going down this path.
Thank you, Miss. I know your time's running short, so I've got one last question coming from the vendor community. So the vendor community has been very active in aged care, and one of the things that came out of this report was the large number of vendors out there providing parts of a solution going forward for aged care. Obviously, post-COVID, we're looking at improving the effectiveness and efficiency of the local Australian businesses. And I know other departments like the Department of Industry through the CRC and other initiatives, Digital Transformation Authority, are also looking at growing local industry. What do you think we can do to help support local industry in developing solutions that can be used locally, but also have international possibilities in a large growing market? I mean, the world is aging everywhere, and Australia, despite what many people have said, has done a fantastic job in delivering aged care to that population. can we take some of those learnings, package them up in solutions and sell them to the rest of the world?
Look, I think that this will be a big opportunity for us, and I think that working together, establishing the parameters and the information requirements that I was talking about a moment ago. And you're right, George, we are recognised globally as being good providers of aged care, and it's something that I know has been talked about for a number of years as a possible export opportunity for us. And I see IT falling into this situation as well. I think that we can, through working together from here, take a real leadership position in the development and implementation of systems that will work for the provision of aged care. I think off the back of the Royal Commission, the imprimatur that we will have to do that will be extremely strong. And that will put us in a really good position globally to be able to provide that export. We have a number of agencies, as you've mentioned, that are already working in that space. But by, I think, us being organised with respect to the way that we want to do that, that's why I'm talking about government specifying what it is, how we want it, and the standards that will apply to that provision will be a really important part, because that will provide the opportunity for everybody to participate in the development of the systems that will assist the sector, and then they can take that next step into participating in, I think, what will clearly be a significant growing market.
Thank you, Minister. So February next year will be a very busy time for us in aged care, with the release of the Aged Care Royal Commission's report. Obviously, there'll be some legislative changes that the government will need to look into. Do you have any recommendations about how aged care providers can prepare themselves for February? Should we be starting work on particular projects, implementing better databases in the back end, so that when the changes announced in February come along, we're ready to go? Any recommendations for the aged care provider and the aged care vendor industry about how to prepare for February 2021?
Look, in the context of IT, as I indicated to you a moment ago, I think that this is something, the reporting of information and the utilisation of systems is something that the government will be asking all providers to participate in. So from that perspective, I would say to all providers, start having a look at what's there in the market. Talk to your colleagues within the aged care sector to see what works for them. And I know a lot of providers are already doing that because I've had those conversations. But also to the vendors, look at and start engaging with the sector. I would like to see this sector be a national leader in this space. I think there's a real opportunity for us to do that off the back of the Royal Commission. As I've indicated, I think this is a really important direction for the sector to go. One of the things that the Royal Commission talks about is issues around governance. Information is vital in that governance piece anyway. So look at your business, look at how it's operating. What are the things that you think you might need to do to improve those systems, and so have a close look at the market. What we clearly need to do from a government perspective is to provide that base of the good business to government to business systems, and the information around the standards and systems and the information that we want. But I think those things are starting to emerge from what the Royal Commission has already said. So again, look closely at what the Royal Commission is indicating with respect to quality indicators, and quite clearly there'll be a requirement for additional financial information on a more regular basis than we currently do at the moment. So what are the systems that are going to provide that?
Thank you, Minister. I think we are actually at a very interesting point in time, because we actually have a confluence of initiatives in aged care. So we have the Digital Health CRC, which is doing some very interesting and exciting work in research in aged care. We have the Digital Health Agency, which is also looking at aged care. The Royal Commission's obviously shone a light on the fact that we have an ageing population which needs more services. So I think it's a a very exciting time to be the minister. I'm sure you've had some times when you've thought it hasn't been so exciting, but going forward, I think Australia's in a wonderful opportunity here. I'd like to give just one last chance. Any final comments you'd like to make to the people attending today before we let you get back to the task of government?
Look, George, just thanks everybody for coming on. I trust that the forum is of value to everybody. This is going to be a very important part of the aged care sector going forward. It's one of the elements of the way that we operate that I'm extremely interested in, and as I've said, we'll be pushing very hard. And so the work that you're doing with this report, but what comes out of it, is going to be extremely important for the sector. So again, thank you to all of those that participated in the report, as you indicated in your opening, during very, very different, difficult times. But also you're right. Off the back of the Royal Commission, we have a significant opportunity for major reform to this sector. And let's not forget the point that you quite rightly made a moment ago. We have a pretty good aged care system here in this country. Are there some things that we need to improve? Yes, there are. That's why we're having the Royal Commission. But we have an opportunity to really step it up off the back of that process. And I'm looking forward to participating in that. So thank you to everybody that's participated in the report. And I trust the forum is a valuable one for you all.
Thank you very much, Minister. And we at the Council and all the various other organisations that I've involved within aged care are very keen to work collaboratively with the government to help improve the quality of care in Australia. So thank you again for your time, Minister. And we look forward to hearing from you again in next year with the ACIITC conference, which will be coming up, where we can find about where we're going as far as the use of technology in aged care. Everyone, please join me virtually in thanking the Minister. Okay. So that was a great opportunity to hear in real time from the Minister what's happening at the department level with regards to technology and innovation. But now I'd like to hand over to my colleague, Anne Livingston, the project manager for the Care IT project and the chair of the National Home Care Committee, to give us an overview of the key findings of the Care IT report.
Thanks, George. I've got a bit of a task here in a few slides to present what was 4 months of around-the-clock work involving both national experts, but also some colleagues internationally. And I'd like to acknowledge Professor Greg Alexander, who's joined us tonight, maybe his time from New York. So I've got to condense 149 pages of work that we undertook. And we really looked at what innovation was happening, what the successes and the barriers were. And I believe that this report gives a real snapshot of the sector at the time. But importantly, it's important to note we were funded just on the cusp of COVID. We were funded for this project on the 13th of March. So our project parameters did change somewhat, and really I'll talk further about those. But it does really give us a clear focus of what some of the key stresses and pain points are for the sector. As the Minister indicated, we looked at 5 discrete areas. Those 5 discrete areas were business to administration systems, importantly, B2G reporting and online to access for government portals, surveillance and monitoring, and we use those terms very broadly. We looked at monitoring of people in their own homes and in residential care facilities, as well as we looked at the options of more community-led monitoring, particularly perhaps for people with dementia. We looked specifically at telehealth and telecare, and this is, I guess, where the research team had the most challenge. We were looking at this in an era of not universal uptake or access to telehealth. then during a time when the Prime Minister announced in April the access to universal coverage of telehealth. So importantly, this report and this project followed that through. And lastly, but not leastly, we looked at smart home technologies and their application. So how many people participated in this during such a busy time, both for the industry, but for communities and individuals during COVID? We were very heartened that we had 421 participants. We ran 2 surveys across the sector and across the vendor community. But importantly, we covered for the industry an industry that was representative of providing services to 661,000 individuals and nearly a workforce of 100,000 with a volunteer workforce of over 21. At the time of doing this, we also identified through the project 420 unique vendor solutions that the sector has been interfacing with. What we did try to capture is the diversity of providers. So we captured providers across home care and residential care. And I'll talk shortly about the geographical spread. But we did capture very large providers, with our largest having over 86,000 customers, consumers or individuals that they provide services to the smallest agency that we surveyed and participated in our work was a very remote provider who was providing quite unique services to 2 individuals in a very isolated community. We were really pleased that we got a geographical spread of every state and territory. And we worked very hard at using our existing networks and creating new networks. So we did get a high representation from each state and territory. So what happened for us during COVID is important to note. We did note during the research that 65% of our respondents did indicate that they had accelerated their use of telehealth and telecare during the COVID original period. And we're hoping that we can revisit this and see how much sustainability is seen from that acceleration of telehealth and telecare. Well, we do know that COVID showed us that we can do it. When we need to do it, we can do it, and we can do it quickly. We also captured where people were doing the most innovation. And of course, it's obvious in remote working and learning. And virtual meetings like these are a real hallmark of our life now. But we also found some fantastic examples of innovation in the supply chain and in manufacturing. And many of those manufacturing endeavours also had a great impact in aged care. And of course, as I reported earlier, telehealth and telecare accelerated. We also did look at the top tech that people were using during COVID. Interestingly, we found that 47% of people had non-contact thermometers and infrared. We noted that 33% of respondents set up screening solutions and stations. We know that people put in place some very innovative mobile apps during this time. We saw an increase of the quality and the vigilance around visitor management. And we also saw an increase in online education. And utilising, I think, some of the smart home technologies, like we noted that 31% were using electronic door entry and door locking. So what did we find in respect to telehealth and telecare? We found an industry that wants to adopt and adapt. but funding models that need to be tailored more. We do know that there's been trials and pilots, but there's a real critical need to embed those into mainstream service delivery. We did identify a series of barriers that you'll outline. And those barriers included just the funding mechanisms, as George mentioned, a real need for boards, for executives to really understand the return on investment and the quality implications. But we also did find issues around the implementation, the need for maybe some best practice development around best usage, and also a real push towards integration with other existing technologies. So we do know that we have described in the report these barriers, and we have suggested a number of factors to improve them. And what did we find in connected community and smart home technologies? We found some excellent examples of smart home technology being applied quite at scale in some organisations. To the other end of this spectrum, some providers not knowing where to start. We found, as we did in our earlier research in the end of 2019, that there's real evidence that smart technologies can enhance the safety and security of individuals. But we also found that cost is still an inhibitor, that there are some concerns about privacy and security and reliability and usability of the technology. So for the vendor community, perhaps a little bit more work to be undertaken. And we see that work is really needs to be in respect to co-design with both consumers of these products, but also the sectors and the individual services in the sector. So we're very keen to promote that co-design aspect, and you'll hear further about a recommendation we made as a result. We looked particularly at surveillance and monitoring technology. And we identified the range of roles that these technologies can play. And we also identified how much of these technologies are being uptaken in the sector. We know that there's scope from what we found that passive monitoring, only 51% of providers who were surveyed were using it. That the data analytics, as the Minister indicated, data is everywhere, but we're not using it as appropriately and as rapidly as we could. We found that particularly in relationship to nurse call technologies. And we also found that there was an increased use of GPS monitoring and tracking, but this was really in respect to monitoring staff and perhaps capital like vehicles, and great opportunities to further use these technologies for individuals. We did also see throughout this work the need for greater integration of the data being produced by this with client records, and that being integrated with health records. This is just a slide of what we found that people reported, that 6% reported that they were using it for asset tracking, 7% for vehicle tracking, 6% for dementia-specific consumer applications, and 16% were using it for staff tracking. But we know that there's greater opportunities for the sector to look at those types of technology. An important area for us, and the council has been working with the department for several years around business and reporting systems. We looked at detail of the usage of systems, and We did find that payroll and accounting and those financial managements were the systems that were highly used. However, we did identify the opportunities along with some of the challenges that we could actually embrace as a sector to get real-time data, to get real efficiencies and productivity in the system. And we did find really a big digital divide between those services who had great maturity to those who might be following the leaders, but some at the other end of the spectrum just really questioning where they can drive their investment in technology most appropriately. We were also asked by the government to look into the relationship between the sector, the providers, and the vendor community and government reporting. There's been a lot of work done to improve the government portals, and we know that and we acknowledge that. However, we do acknowledge that our report found that there's still a number of difficulties with those government portals, a number of challenges, and a number of individual service providers spending a lot of time trying to work around solutions to get their data produced or out of government portals. So clearly there's a lot more work to be done. We looked, drilled down, and this is really probably the first opportunity to do this nationally. We drilled down on, for example, the DEX reporting submissions, and we found excessive, in some cases, excessive time being used to provide those reports. And we're very active in working with the department about trying to find solutions to this. But as George alluded to before, we can do more work around integrating My Health Record and My Aged Care portals, and that we can do a lot more work around improving the ease of use, streamlining the access to the data, both ways. We found many examples of where we tried to get data to enhance our research, and that services had tried to get data out of those portals to drive their businesses, and there were barriers or lack of access to. So we're working very closely on some co-design activities with the department, but also benchmarking and working around identifying the opportunities to share data. So we came up with the recommendations, and I know this is the first opportunity. George, we've been able to talk publicly about the recommendations. We have been doing a lot of work with the Department of Health, and I thank the colleagues there for their enthusiasm and positive nature in which they've embraced these recommendations. We have a series of activities aligned to these recommendations, and we have had now a couple of months working with the department to detail and refine those. I'm not going to talk you through those recommendations. You can take the time to read them and absorb their full scope. But I guess we really believe that this report and this research really provides the opportunity to really start to develop some digital maturity goals for the sector and a strategic plan of attack. And we'll certainly be working very closely with the Minister's Office and the department to see that happen. But we do know that an investment in the industry and in its innovation and uptake of technology is extremely important. And how we approach that is, as George indicated early, a really key focus of our work going further. We've been inundated with some support from the accounting and financial sector, and we look forward to working collaboratively with them to suggest some ways of better funding, providing a return on investment. But also we do believe that there is a need for an industry innovation fund and for those dollars to be provided. The B2G is a big factor in the work of the Australian Aged Care Industry Technology Council. We've been focused on streamlining B2G, and we look forward to working with the department collaboratively to take that work forward. We also see that there's great opportunities to repeat in part some of the survey, and we will be going to the market in the coming year with some refinement of the key issues that we surveyed and attempting to benchmark them across the next couple of years. I talked earlier in the smart home component about the need to co-design and the need to produce, I guess, avenues for providers and consumers to really get involved in the future that innovation and technology will provide. We did propose a national network of living labs in this report, and we have been working with our colleagues in the digital health CRC, and I acknowledge those colleagues that are on board today, in researching internationally best practice around living labs and see fully the opportunities that they can provide for better service delivery, better quality and safety for older people using and accessing aged and community care. So I guess we conclude by really focusing on the need to improve the digital technology, digital maturity of the sector. And really we have a great vision around some of the activities that we can do to help assist that. We did identify extreme vulnerabilities with cyber security and safety, and we believe that a coordinated national approach to some of those issues really need to be addressed. We also believe that great improvements can be made in respect to the standards, service standards applying to the sector, both in terms of reviewing them with a technology and innovation lens, but also being able to use the data, as the Minister mentioned, to improve quality in real time. And we found a lot of evidence of great opportunities. So we are working with the Commission on this, and we look forward to advancing that and having more to report shortly on that. Our recommendation 8 focused on the establishment of a national clearinghouse. We know that there is work undertaken, and we are involved in that work in looking at a translational research centre, and we endorse that work. We found many projects, many outcomes that we actually couldn't access for whatever reason during this report. And we believe that access and more national ability to be informed by the results of, say, investment by the department in innovation projects, as well as in being able to access some of the service providers' own investments in innovation and technology, perhaps more in the grey literature. So we really endorse the need for a national clearinghouse. And our last recommendation really related to the time. We saw many industries downturning through the time of COVID. Many of those industries have particular skills and sets of technology that we could see are very translatable and transportable into our sector. And we have identified a series of those that maybe will also create some economic recovery for Australia, but also provide advancement in innovation and technology for the sector. And we're continuing to explore those. So George, that in a nutshell is my overview of the report. I know I'm going to hand back over to you to perhaps acknowledge those people who were involved in the report. Thank you, George.
Thank you, Anne. And you did an amazingly good job in taking 4 months of concentrated work and presenting it in 15 minutes. But I do have to tell everyone that the devil is in the detail. So I highly recommend you download the report from the council website, ACIITC.com.au, and spend a few hours over the weekend reading a very detailed report, which looks into a lot of areas of the use of technology in aged care. And I specifically asked you to have a look at those recommendations and think about how you can take on those recommendations and work with us at the council to develop on those recommendations. So there are a lot of people to thank for this report. We literally spent 4 months learning Zoom, living Zoom, and I think totally using our license for Zoom. And I say that because we had representatives from across the country and actually from across the world helping us on this project. So there's a few people we need to thank, and I'm going to take this opportunity to thank them. If I don't mention you personally, please excuse me, but there were a lot of people involved, but everyone who was involved knows who they are, and I really thank them for their help. From the Department of Health, who were the project sponsor, Nick Hartland and Alison McCann were pivotal in helping us get this project underway and launched, and I really appreciate their support. And I really strongly appreciate the support of the department's liaison team, Mr. Don White, Ms. Catherine Burkett, and Mr. George Lemon, who provided us with a conduit backwards and forwards from the department as we developed on the report, so that we could develop a report that was more than just a litany of issues, but a report that actually was proactive and allowed us to look at solutions to these issues going forward. I have to give a special thanks to the project team who worked day and night. And again, I use that term quite literally because I had many meetings at 6 a.m. and many meetings at 11 p.m. that allowed us to complete this report. That's Ms. Anne Livingston, who you heard from, Dr. Kate Barnett, OAM, Mr. Gavin Tomlins, Ms. Lisa Kapamagian, and Ms. Georgie Gould. And that group spent many hours refining the report, taking it from what was literally gigabytes of data into the succinct quality report, which we believe we've released. We had a strong expert advisory committee, which included Rod Young, Professor Greg Alexander for the United States, and Dr. Claire Mason from Data 61, which I had the privilege of chairing. And that was a great opportunity to learn from experts in their field on how we can take some of the ideas used in other industries as well as other parts of the world and translate them to how we can use them to improve care in Australia. And finally, I'd like to thank the National Report and Business Reference Committee and the Industry Co-Design Group, which included Mr. Bruce Collar, Mr. Nigel Ford, Mr. Jeff Carson, Ms. Glenys Webby, Mr. Matt Moore, and Ms. Lana Ramsey, who helped us develop a lot of the business to government reporting for requirements to enable us to provide that part of the report, because that was an area where we needed some strong support. So all in all, there was a great group of people who spent a lot of time, who leveraged technology greatly. So, thanks to COVID, we shifted from our original plans of face-to-face meetings, and we ended up using a lot of technology to make things work. We also have a number of case studies referenced in our report, and I'd like to thank the people involved in helping us develop those case studies. So from Ferris Care, Mrs. Janine Buckley and Mr. Glenn Payne; from RDNS, Christina Walsh; from Juniper, Dan Beeston; from UMS Health, Adam Junkie; and from 2 aged care GPs, Dr. Amandeep Hansra and Dr. Sachin Patel, who gave us a great insight into the challenges faced in delivering acute care into the aged care community. At this stage, we're going to open the floor for more questions around the report. We specifically like the people to focus on any questions they have about the recommendations or around next steps. But if you have any issues around how to leverage this report within your own organisations, how to leverage this report at a government or a community level, how we can use the report as a stepping stone to improve the quality and safety of aged care in Australia. So we've got joining us now, Gavin Tomlins, Rod Young. I think Anne should be there as well. and Livingston. Let me start off with a question to the panel, and we'll then get quite welcome questions through the Q&A panel. So where to next? We've got a great report here. It's highlighted the challenges. It's highlighted recommendations around solutions. Where do we go to next? How do we take this report and use it to implement change, drive change in the aged and community care sector? I'll start off with you, Anne.
Thanks, George. We've got a number of national forums mandated for next year. Those national forums will have a focus on bringing the recommendations forward, but also benchmarking the findings that we found. That we're also looking at a number of projects, working with key colleagues such as those that you've mentioned, the Digital Health Agency, the Digital Health CRC, several other universities. We believe that there's really scope to revisit our technology roadmap that was released in 2017, to revise that solidly and to perhaps provide a 2021 roadmap for the sector. I think the work that the committees of the council do, the CIO's Forum, the National Home Care Group, the ACIITC committee, all inform that work going forward. So I might hand over, George, to Gavin and Rod to comment.
Yep.
I'll go first, so Gavin here. So I guess further to Anne's comment, I guess there's the national forums, and we are looking for people from the industry to come partake in a number of subcommittees. I noticed throughout the Q&A there was reference to B2G, and obviously that's one of the recommendations throughout the report. So I guess post forums, it's a call to arms to our colleagues to come forth with their particular user experiences, to work collaboratively with us as we work with the department on working out solutions and the best way forward to address some of these challenges.
Thanks, George. I think that the key areas that we need to focus on is the quality systems and integration, and that when we are developing future technologies, that we actually are integrating systems design and systems improvement and quality performance outcomes. And I think if we use that as a driver, it drives just about everything else, including workforce efficiency, financial efficiency, and systems design.
Cool. So we've got a question around specifically looking at secure messaging, but I'm going to extend that question a bit more. So one of the issues highlighted by the Royal Commission was the difficulties in communication between acute care and aged care and general and primary care. And you know, in the acute care and primary care sector, we've tended to use secure messaging a lot. Any idea about whether secure messaging could be extended into aged care so that the current paradigm of two different silos of data can be prevented, and we can actually have a better integration between aged care, primary care, and acute care? Gavin, you're probably the most technical one here, so I'll get you to kick off about it. Are there any technical challenges there, or is it more just a requirement for us to make it happen?
I think it's more of a requirement for us to make it happen. I guess, as was highlighted within the report, there were some concerns around cybersecurity and privacy. The council recently had a forum where we spoke about the implementations of FHIR and where that technology stack sits within the industry. So I think it's a matter of education from the top down to understand what it is. It's not necessarily a hard technology, but I guess also for providers and vendors to have that on their roadmap. At the moment, there are a lot of solutions out there where people are just text messaging and so forth, which was sort of evidenced within the report. So it's more education and then aligning yourself with the right solution to deliver privacy and care to the individual.
And Rod, any comments on that?
I think you need two components here, George. One is that you need an open communication with much less security attached to it for your communication across some parts of consumers, particularly home-based consumers, and their families related to residential care residents, whereas we need the second component to be matching with the security level that occurs across the public hospital and greater health system, so that you are, I think, recognising the integrity of the information transfer between the silos that hopefully then starts to reduce that silo structure, whereas you are still producing an open communication channel to communicate effectively with families and relatives.
Good point, because the question, of course, is that we can make it very, very secure, and that we very much limit who has access to it. But as we recognise in aged care, it takes more than just an aged care provider. It provides a whole community to provide care to the elderly, and making sure that information is shared is very important. Question to Anne, and I guess Gavin and Rod, your feedback as well. One thing that came out in the report was the large number of vendors who are solving small parts of the overall aged care problem. Do we see the need for greater coordination across the vendor industry here? And I recognise the MSIA has been doing a great job in working predominantly with the medical software industry, and now more and more aged care providers are playing a role, aged care vendors are playing a role in MSIA. But how can we work with the vendor industry to help them develop total end-to-end solutions that incorporate many of the great innovations that are coming out of Australia? Anne?
Thanks, George. That was really an important thing that we identified in this work. 420 unique technologies being applied to more than 400 unique issues. And what we did find is very little integration. We did find some examples of very smart moves to integrate a lot of things together, and we've recognised some of those individual agencies who are taking that role in our ITAC Excellence Awards. So we can see that there are examples of people focusing on the need to integrate. Yes, we can work with the vendor community much better. And I think the proposal around heightening the level of co-design that's actually being undertaken with the sector provides great opportunities for vendors to be involved at the coalface of redesigning, creating, or co-designing different approaches. So I see, George, that there's a huge amount of work that will see a huge amount of improvement if we can focus on some of the key stresses that we identified in the report, where interfaces just aren't working and causing a lot of lost productivity and lost efficiency.
Gavin, any comments on that?
I'd reinforce, I guess, Anne's comment around MSIA and around the collaboration piece. I guess also from a vendor perspective, if they were to, I guess, as Rob was saying, focus on their interoperability. We were doing some analysis of the vendor solutions and who were providing APIs and basically open standards and communication. So that facilitates conversation amongst the industry and gives us opportunity to do so at the moment, but just go by the MSIA, provide us with some documentation interoperability so people and solutions can be basically work together at this point in time.
Okay. Rod, any comments to that?
Very much reinforce both those comments. I think we need to ensure that we have the greatest opportunity for innovation to evolve and develop. But at the same time, we've got to provide the infrastructure. And as Gavin just said, the interoperability that will actually make it easier then for vendors and providers to actually utilise different solutions seamlessly.
Thank you. So we have a question here from Anissa Hansen around the adopting or resisting of the technology by the workforce in aged care. Now, many of us remember very early on in the Royal Commission, a number of aged care workers were being interviewed by the Commission around their use of technology at the bedside, and many of them sort of questioned the challenges associated with that. From the report, do we have any feedback about how the workforce is adapting to the technology and what we can do to help that workforce better able to use the technology and maybe even play a more active role in helping develop that technology? Again, I'll kick off with you, Anne.
George, again, great opportunities for improvement here. Digital literacy was identified in all our work as a key barrier. The digital literacy of the workforce, we know extensively women, maybe over the age of 45, who haven't grown up with an iPad or been born with an iPad. We find that there are great examples of where services have made the technology much more workforce friendly, and we're seeing then greater uptake. This is an area, I think, George, that co-design via a living lab environment will also provide great opportunities to enhance that. And I'd just like to acknowledge Enlist's work. She's doing some great groundbreaking research into this area, and we hope that she's able to share that work shortly.
Gavin, any comments on that?
I guess further to Anne's comment, as Anne highlighted the digital literacy of the workforce, I guess the findings also showed that maybe there was a dependency of organisations just to rely upon vendor training and vendor solutions instead of having a look at a whole of a workforce solution. And yeah, so just going beyond the vendor supply type technology, but basically embracing it from day dot and making it a cultural thing from the top down.
We identified a need for like a minimum standard, much like a Cert 3, a national police check, but a minimum standard around a minimum entry requirement around digital literacy as well. And as Gavin indicated, we can only do that if we've got a more coordinated approach in terms of our training and education.
Rod, any comments on that?
No, I think it's becoming of the industry providers to recognise the nature of the workforce, as Anne just mentioned a moment ago. And I think the other part of this equation is the number of providers that we see where the time, training and education and implementation of a technology solution is done well. Staff become converted and in fact heavily dependent users of that system. But when that time isn't taken, that training isn't applied, and the change management isn't used effectively, you can get resistance, and the resistance needs to be recognised at the front end and then dealt with effectively by management.
Yeah, I have to reflect on that because having been involved in the early days when we were introducing technology into acute care, and it was interesting, it was very well reflected yesterday. Professor Michael Kidd gave a presentation at the Australian Institute of Digital Health Forum yesterday from Adelaide, talking about the early adoption of GP technology back in the late 90s. And the reality is that the first iterations are always going to be difficult. There's going to be challenges. There's going to be a strong need for support and help. And I think one of the key learnings we can take from that experience is that it's more than just implementing technology. It's having a strategy around the training, the sharing of the benefits with the workers around how they use technology. But Claire Mason, who was on our expert advisory committee, makes a very interesting comment here, and I'd like your feedback on that. One of the challenges is how do we develop career pathways as a result of these new technologies being used by the workforce, so that people actually have can develop new roles within aged care beyond just the standard roles we have today, where they become proponents and users of this technology and facilitate its use. So how do we co-design within the industry new workforce capabilities and new workplace requirements and new positions for people, for technologists in aged care? I'll start off with you this time, Rod.
I think it's a very interesting challenge for us to try and address this issue, George, because the industry in part is structurally deficient in that it has many small operators. So how you then create a career path that will respond to the technology solutions is, I think, a problem which we are yet to solve. However, one solution that comes to mind is that some specialist nursing positions have been shared across multiple providers and done quite successfully over the years. If we think about how we could have a whole of industry approach to this question, then maybe we can come up with career path options that are not just confined to the very large providers, but can then create career paths that can actually be shared across multiple service providers when we go to the small end of the industry, both home care and residential.
Gavin, any comments on that?
I do. I guess we're speaking about digital literacy and the opportunity for career pathways. Throughout the Q&A panels, there's reference to quality indicators and where it sits within the continuum of care. I guess there's opportunity within the workforce if we start looking at information and data and how that's used better. That's a transferable skill from each industry. I think coming back to understand the importance of that quality of data and how that can affect data, and also provide transparency throughout the process. So I think there are transferable skills there at this present point in time.
And Anne, any comments on that question around career pathways, how we can help develop new career pathways for people in digital aged care?
George, yeah, I think acknowledging Claire's work there, Dr. Mason has done some really in-depth analysis of the importance of really strongly considering this issue. We also saw some international examples where new and emerging roles were occurring. One, for example, where the greater uptake through Europe of assistive technologies, broadly defined. We're seeing new roles, not only new roles with applying the assistive technology, perhaps as a case manager in assessment and referring to those types of technologies, but also in the whole new area of maintenance, repair and installation. And we see that there are a number of emerging roles there that need to be shared for the ability to scale them, or need to be looked at quite differently. So in terms of the work that needs to be done there, I think actually there's a lot of work that hasn't been done in this workforce development area. And I believe that the council is really keen to push some of those forward, because without an informed, properly trained and skilled workforce, we're not going to also see any really significant differences in the digital maturity of the sector.
So if I can provide a bit of a glimmer of hope for those out there who are looking at career paths in this area, when I first graduated from medical school back about 30 or so years ago, there was absolutely no career path for digital doctors. We were an exception to the rule, and the people who were considered to be the outsiders. Now every state in Australia has a Chief Clinical Information Officer. Each organisation has a CMIO, Chief Medical Information Officer, a Chief Nursing Information Officer. So we actually found that it took a while, but as we use the technology more, we developed new career pathways. So I think from that we can learn in aged care to facilitate that, so that we can actually develop Chief Clinical Aged Care Informatics Officers or something to those likes going forward. So coming close to the end of our time, let's look at the cutting edge of technology. So I have a question here from Contact. Are there any findings in terms of the popularity of adopting emerging technologies such as robotics, virtual reality, or applying AI in aged care? And I know we looked at this in the report. And got the comment about those cutting edge technologies, how are they being used today, and what opportunities do we have in the future to utilise them more?
We did identify services that were looking at those range of technologies that you've just indicated, but we didn't find many, George. I think the investment required to be first adopters in those perhaps is a barrier to adoption. We did find, particularly in our report, December 2019, that great opportunities abound by really looking at a vision of taking those technologies into the sector more. I guess that's an area also that we identified, George, big opportunities, a great degree of work that could be done there.
Gavin, any comments about that? Those cutting edge technologies and how we can implement them better in aged care in the future?
I guess it's a bit of a segue into the previous conversation around digital literacy and where those roles sit within the various care organisations. So there is opportunity there at this present point in time, but it really has been identified as a key role historically. So as Anne sort of alluded, the report and findings didn't sort of show a widespread adoption, but I guess in the back of my mind, I'm trying to equate that. Is that because of financial investment or having the right skill set within the organisations and understanding the benefits? I guess as Anne sort of alluded, I think there's opportunities there to sort of research and sort of highlight some of the case studies of where it's been done well throughout the industry at this point in time.
And Rod, any final comments on that area?
Yeah, I think we have to be conscious that technology is evolving quite extensively and at a very rapid pace. And what we are considering today as evolving technologies is likely to be fairly normal within 5 years. Therefore, I think we need to be thinking about how do we maximise the opportunities for the future through our funding mechanisms. And I note that the NDIS, for instance, is far more attuned to providing a component of care recipients' budgets that can have a technology component to it, far more than the aged care system has been traditionally attuned. So I think there is some need for us to be thinking, how do we maximise the advantages in evolving technology to maximise quality outcomes, consumer engagement, consumer choice and decision making, and enable that through the funding sources from the Commonwealth.
Thank you. So look, I just note that also the Department of Industry, Science, Energy and Resources has recently released an Artificial Intelligence in Australia action plan. So I think there's opportunities for us to look at that. And I recently attended with the Digital Health CRC an ethical use of AI in healthcare. So lots of opportunities there, and I think we need to take advantage of those. We've had a lot of questions around funding. I recognise we are running out of time. So what I'm going to recommend is that we have a forum in the new year, specifically looking at funding opportunities, but also measurement of return on investment in the use of technology. I know we've already been planning that within the council. So rather than try and shoehorn that into 30 seconds, which is a large issue, and of course, come the Royal Commission findings in February and the budget in May, there may be new funding opportunities. But I'll note that there will be a forum in the new year specifically looking at the financial issues of the use of technology in aged care. We've come to the end of our time. I'd like to thank all our panelists. A special thanks to Minister Richard Colbeck for his support for our project and for his spending the time with us today to answer questions that obviously many of us have on our mind. These forums will continue on going forward, so please keep an eye on the ACIITC website for more information. Join our mailing list. The report is now available for download on the website. Please review it, comment. We now have an Aged Care Industry Information Technology Council LinkedIn group. If you want to have a discussion around this, we all have a few hundred members on board already. This is an opportunity for a forum for us to discuss this in more detail. Thank you again to my panelists. Thank you to everyone for attending. Thank you for taking time out of your busy day to take part in this important forum. We look forward to continuing discussion and helping deliver better quality aged care in Australia through the use of digital technology. Thank you, everyone.